Okay, good morning, everybody. This is Robin Strongin with Health Team, and today I'm going to talk with my longtime friend and colleague, Sam Simon. And Sam, we've known each other quite a while, many years, and our paths have crossed in a whole bunch of different worlds, right? I mean,
Absolutely. We could go, in work, and our religious and synagogue, and uh,
yeah.
like we are both past presidents of different things.
Yeah,
How about them apples?
and we still stay connected,
Yes.
and it's just a real pleasure to be able to have the time to really dive into and learn a little bit more about what you've been up to since your Alzheimer's diagnosis, which you've been very public about sharing, as I was with Brian when he was diagnosed with Lewy body dementia, different type of dementia. But your life has been a series of fascinating twists and turns working with oh God, I just
What's
had
his
a
name?
brain
I think we call
freeze.
him Ralph Nader.
Nader, right. Yes, unsafe at any speed.
Yeah.
And so what did you do with him? What were you doing when you worked with Ralph?
Well, I often like to say, be careful who your first boss is.
Yeah, isn't that the
May
truth?
determine the rest of your life. I graduated law school in 1970, and I was among the first 13 lawyers, full-time lawyers. He had students called Nader's Raiders, as a slight distinction. And he started something called the Public Interest Research Group. They're still today college-based in various public interest research groups, but this was the first, and I was one of the first 13 to do it. Then had some side trips and did various other things, was on the Hill for a while. And he came back and asked me to go take over what had been a failing nonprofit. And I did, and worked for him and around him um, up until I started a public affairs firm, which you're familiar with. I faced having two kids going to college, and if you would know anything about Ralph Nader, he paid almost nothing, and so he had to get serious. And we did a public affairs company. You came in and were sort of a partner in that later on, and had a big role there, and did that. Ralph is still a friend. Ralph is still a friend.
That's fabulous.
People aren't. I often get, oh, Ralph, he's still alive. He's 91. He's about to turn
Is he nine?
100.
Oh my goodness, he's in his 90s. Wow.
He's going
Is
to
he
be in the
still
next day or two, 92. I forget which day in February. And he's interviewed me about my new role and the new book version of Dementia Man. He has a weekly podcast. So, yeah, that is a big part of my history.
It sure is. And technology is also a big part of your history, right? I mean, you really are one of the biggest fans of technology I've ever met. Every time I see you, you have a new gadget of some sort.
Well, the Washington Post once called me the gadget guy, but I'd like to do just a little distinction. I
Okay,
was an early, I think, not just a fan, but I had the ability to imagine the value of technology
exactly. Yes, that's fair.
a little
Yep.
bit more than I could make anything. I
Yeah,
couldn't,
no, no,
I,
no. The
I couldn't make
yes.
it happen. I can't program well, and maybe we have this in common. We have good people working for us who
Yeah,
can.
exactly.
Why can't it do that?
Yeah, exactly. No, but
Well,
it was your vision to see the power of the tools. And that's where you and I crossed because you
yeah.
were in telecommunications and all of the new technology. And I was on the healthcare side of things. And telehealth was finally starting. It had been around for a long time, but finally the ability to do something and scale it started to become real. And that's
Yeah,
where I think we started to really collaborate.
yeah, and the American Telehealth Association was started in our firm.
I know it was
It
with
was
John Linkus and
John
you and the
Lincoln,
whole gang. Yeah.
and they saw it wasn't my what's his last name, Sanderson or Sandra. Anyway, um, I didn't see it that as clearly as they did it, and which is an interesting thing. I mean, even Ralph, I love it that I could see how it enabled people to communicate and to integrate, um, and just change our individual lives on
Well,
how
are
we
you
have
using
access.
telehealth now when you have doctor's appointments, or do you tend to go more in person to your appointments?
Tend to go to more in person. It's interesting.
Because
I
we
mean,
did a
not that I'm
lot of
against.
telehealth.
It's not that I'm against it at all. Other than it's interesting because the neurologist is literally walking distance. Not that we walk, but he's walking distance.
He is? Because
Yeah,
I think I shared with you, Brian and you share the same neurologist. Brian, of course, has passed now, but he had went to the neurologist you do. I didn't realize you guys were walking distance.
so we're downtown McLean, Virginia. MedStar Health has an office. I don't know if it was,
Oh,
but
you're in a different location than we were. We were in McLean also, but anyway, it doesn't matter.
you were a little further away.
Yeah,
So
yeah,
this
yeah.
he's
But
on
same
he's
doctor, he traveled. Yeah. But we also did a lot of telehealth because, of course, some of it was during COVID too. And then that was that, I mean, you had no
yes,
choice really.
yes, yeah, right, of course, and I we do it periodically, but it's we've been able to meet. He's quite close, so and we don't have COVID.
Yeah. Thank goodness, right? That whole episode is behind us now. Let's hope. Let's
Yeah, for the
hope.
moment.
Yeah, so when did you notice something wasn't quite right? How did this all start?
It's I'm going to jump for a second.
Please do.
I probably noticed something along early, very earlier, well, much earlier in the early 2000s, when I had or late 1900s when I was doing issue dynamics and our company, and I can still remember the day I had an annual physical with my then internist, and as if I'll do this as it's over, and I'm buttoning my shirt again. I go, doctor, I won't use his name. I think I have some trouble with my memory. Oh, Sam, I know you. There's nothing wrong with your memory. And I've been my doctor for 20 years. He said, now, if you couldn't remember what you had for breakfast, then I'd be worried about breakfast.
It's just the classic interaction. Yep.
And though he didn't send me to a neurologist, he sends me to a psychologist who then he did a mini mental, but I guess I did pretty well. And he gave me actually the drug. I remember the drug this time. I'm talking about that Wellbutrin, which is a
Yeah, yeah.
standard drug for anxiety.
Yep.
And I was part of a group of CEOs that met, a support group, and found out half of them were taking Wellbutrin. And I'm just an over anxious guy trying to run a company, and I'm not doing it very well. Anyway, then so it was almost 20 years later. I, sort of it was really the biggest things was getting lost and
Mm.
and driving on the most alarming things. Um, I think I noticed stuff, but I didn't seem unnatural. It seemed quote normal. In fact, when I complained to my internist for a number of years, 2 or 3 years, about memory, he said, "Oh, Sam, you're just an overeducated man overreacting to normal aging."
Hmm. Therein lies part of the problem, but continue.
Absolutely,
Yeah.
absolutely. And then, the fact that, I would still remember leaving the meeting, um, turning the corner, started driving, and then the guys coming down, honks like hell, and then other honking, and what's going on here? And then when I noticed the next intersection, people turning into my lane of traffic, I
Mhm.
realized where I'm at
Yeah.
and why they're honking.
Yeah, yeah,
And
yeah.
then it happened once again. The biggest thing that happened, and we jumped there, as these symptoms were manifesting themselves, I was just having trouble remembering. I can still remember sitting down to remember something, write something, or type. And I wanted to remember, and I'd close my eyes and I would experience, I dramatize it in the play I wrote, but it would just be blackness. There's nothing there. And it says, and I did have this image of me floating in
Oh,
nothingness in my head. And it bothered me. It was bizarre. I never experienced anything like that. I'd pop back. It felt like forever, but it was probably a second or two.
yeah.
But in my head, it was, what's the
Do
name?
you
What's the
think other people noticed some of these changes? Did anyone say anything? Your wife, your kids, colleagues? Because I
no,
never noticed. We
even
worked
now,
closely together,
yeah, even now I will get, oh, Sam, you don't have it. And I said, well, let's see. Let me tell you the number. Well, in the place, well, I have had the MRIs with contrast. I am amyloid positive. It is um, early stage, not early onset.
Mm-hmm.
There is a difference because I am 80 years old.
Right.
That's not early onset. This is early stage.
Yeah,
Uh,
there's a difference for sure.
and some people get confused by that.
Yeah.
Um, and there's this other thing. I'm an early adapter to technology. As a result, I don't know if you remember, we had a IDI with pre-web. We had
Oh, yeah, yeah, yeah.
what do you call those things? You have a computer, people could log into it. Um, they had a name back then. It was one of the earlier
Oh
destinations.
God, I'm the wrong person to ask. I am the last of the technology adopters. I still take notes on paper.
But
Um,
but anyway, but people with long hair. So I even had that. Now I was going to that for some reason, but I've forgotten now.
yeah, you were the gadget guy. I mean, the Washington
Yeah,
Post wrote it. You were very
yeah,
early adopter of all those kinds of things. Yep.
yeah. And so I don't know. People just wouldn't think that I quote had it, and that's us another caution to everybody. Oh, so we even had that early on. I was one of the first people to do 23andMe.
23 and Me. Oh, okay.
That's where
Okay.
I was going. 23, I did 23andMe. And it said I had one instance of something called APOE4, never heard of it. Said you're at slightly higher risk for Alzheimer's. I didn't have any one of my family I was aware of with Alzheimer's. And I had some other genetic risk for Parkinson's. As far
Mm.
as I know, I never had Parkinson's and I didn't know anyone in my family that had it. I have since learned, and I think also the sciences, that one instance is 25 to 30% over typical, which is about 20%. So there was a 50-50 chance I could get it. I have since learned that my father's mother, the grandfather on my mother's side, my father's side, my grandmother on my father's side, different last names, right? They were
Okay.
blonder, their names are blonder, but there's just tons of Alzheimer's in that family.
Oh,
So I
interesting.
presume my instance came from that side of the family, but I
Interesting.
didn't understand it as a real meaningful risk to anything. Not until much later in the role and said, oh, so I was, that's why again, that probability pointed us to
Got it.
looking at some. Now, there's something relatively recently that says some study that argued, medical study said if you have two instances, so you can have an APOE4 gene from either side of the family, so you can have up to two, that if you have both, you should be treated as if you have Alzheimer's from the day you're born. That the
The
risk of
likelihood is so
is so
high.
high. Um, I'm learning more than I ever needed to know about Alzheimer's, but in the risk. And, I think, and we can get to this at some point, there is such, I'm, I talk about it. I say, if you know of anybody in your family that may have had it, be checked. And I don't want to know. I get so many, I don't want to know. I don't want to know. I can't do anything about it. Why would I want to know that? Please, there is a lot you can do. Not a cure, but I mean, well, I'd love to almost end on this way, but we have something to give to science living through this disease the best we can. It can be unpleasant, it can be expensive, and going through the disease, we can perhaps, hopefully, um, add to the science.
Well, that's such a important point and a generous one. And I do think that what you're doing with Dementia Man, which we're going to start talking about, is really the essence of where a lot of my time is, which is using the arts, very broadly defined. So theater, music, poetry, gardening, whatever it is, cooking, visual arts, dance, all of it is a way of engaging with people who may not realize they either have an interest in a topic or they should at least understand something about the topics we're all talking about. In this case, it's dementia. Um, there are so many ways to share the important experiences and what to do in a non-threatening way, or not everyone wants to read research studies, not everybody wants to get all academic and data, but hearing your experience and seeing it through the theater is such a wonderful way of starting to be exposed to some of these topics and make it personal, right? So there's the story you're sharing. So what was it? How did you come up with this idea to do this? Is not your first theater run, is it? Actually.
Well, it's a non, we talked about it on Ralph Nader Advocate, and I was a little, I like to say my son called me a minor celebrity. I'd been on the
I would
front.
say a big celebrity, actually. Not,
Well,
not
no,
so
well,
minor. You're a big
back,
personality, that's for sure, Sam.
but back in 1971, we were on the front page of the style section of the New York Times.
Well, there you go. Right, right. With your yeah, in front of the Wall Street, right? With a big
Well,
screw or something. You were advocate, and I
well,
remember this
no.
one. But
Well,
go
this
ahead.
was the New York Times, and then
Maybe that
now
was a
we just
different.
just had a big feature of us in the Washington Post. Um, so minor celebrity, but more importantly,
Hmm.
I had been introduced. Um, I'd done a little community theater, but some things I think are meant to be, but they're accidental as they happen.
Yep.
I done a little play, and I had a role in a community theater here, and then in Washington. Somebody I was in the cast with said, there's this little improv group forming. I think you might like it. Improv? I've never done improv. And that led me to connect with a group called Artistic New Directions in New York. And I was privileged to do some serious training in theatrical improv with the late Gary Austin,
Mm.
among others. Gary had been the founder of Groundlings in LA, where all the first Saturday Night Live people.
Yep.
I was so good, he screamed at me all the time for being so bad. But he became a friend. But learning, and so when I was confronted, and in fact, it was through Gary, Austin, I found this when my wife, Susan, who is just fine, is now known as my cognitive navigator, um, got very sick, advanced breast cancer. They found a post mastectomy lump that they thought was, they pulled me aside. She said that she's going to die. But it turned out to be a water cyst. And I was going through this at the same time I was going through a training and workshop with Gary Austin, and I started discovering characters. Part of the training, one of the training is talk for 20 minutes. Anybody want to learn how to improvise? Just go talk for 20 minutes.
Oh,
Don't,
wow.
can't stop. Just keep it. And I said, and then there was this doctor, we called him Dr. Happy. It's like, what? Anyway, so I found theater, I found that. I wrote a play, was doing that even. You want to know about symptoms? I was doing that even as my symptoms of Alzheimer's began to form. And in fact, during the pandemic, I was able to perform that show called The Actual Dance
I
Zoom,
saw that. I saw that show. Yep.
over Zoom. for a lot of the Gilda's clubs in the country. And Susan would occasionally sit on the chair and watch me do it. And I started forgetting my lines. I've
Mm,
been doing it over and over. I mean, and she started hitting me. And that was another sign
sure.
that something was happening. So you had the driving and the traffic, and now I'm, a show did hundreds and hundreds of times, never had a problem. All of a sudden, I'm losing my place or
And let
needing.
me interrupt you. When Susan mentioned or teased you or whatever, were you denying that were you trying to rationalize why you didn't know your lines, or did you say, oh, there's something going on that I should be concerned about? Because,
By itself, it was sort of, well, we're in this different environment. It's
yeah, okay.
getting confused. It's good to have it. And what, enough times, then you start having some other things. But even with, so I mentioned this nothingness placed in my head,
Yep.
driving on the wrong side of the road, forgetting my lines. And I go to my doctor, and all I get is, oh,
You're overeducated.
the guy overreacting. Except when I started telling about that dark place, what I call
Ah,
the dark place, that seemed to have alarmed him, and that's when he referred me to a neurologist.
so that of all the things you shared with him, that was the one that got his attention. That's
Yeah,
interesting.
yeah.
That's
and
interesting.
and then so much of this play and this journey is uh, how challenging the neurology world is today.
The neurology world? What do you
Oh
mean by
yeah.
that?
Well, our first neurologist, it's, we no longer list memory as an area of practice, uh,
Interesting.
cognitive. Um, and we ran into others, and I've run into this before. There's no cure. But this guy hadn't done it much before. He basically, by and large, he's the one that found out that I know. Well, he had me. I went through with him, found out I was mildly cognitively impaired. There's a neuropsychological exam.
Yep.
It
Yep.
is sort of the gold standard of just standardize how you do compared to your
Hmm.
cohorts. So I was compared to any lawyer to lawyers at 76 years old who were white, lived in urban area, blah, to get this whole thing down. And when I tested out, I did worse than average. Therefore, I'm mildly cognitively impaired. And he said, people who know this field said, here's some Aricept. You're only going to get worse. I've got to go. I have other patients waiting.
Oh my God.
Go to the front desk. He's left no instructions. We'll be in touch if
He
he
just
wants to
drops
see
this
you.
bombshell on you and then leaves.
Yeah. And then
Unbelievable.
that's just mildly cognitively impaired. Now, and by the way, if you take Aricept, now I don't take that yet. It's a more advanced drug. I take something called galantamine, but either one of those, you start low dose and work up. You don't just start taking
Started
it,
out right, right, right.
whatever that meant. But we didn't know. We were just confused. And
Oh, this is terrible.
thank God for my wife. It's in the play. We get in the car, and this is true. And she says, "We need another doctor. We need to talk to somebody else." And she called a friend of hers whose now late husband had a cognitive impairment, recommended their doctor, which your husband had, and we've had a much different experience with them. And we went through, but it was challenging even today. Getting all the tests you need can be challenging. What we needed to do, the next step, was to get a PET scan of the brain with contrast to see if we had um, tau tangles or amyloid plaques. And it was still not typically covered by insurance.
Oh, I know, and they're thousands and thousands and thousands of dollars.
Right.
Yeah.
And luckily, through the referrals, we were connected to Georgetown uh, Memory Center.
Hmm.
And they had gotten, back when the federal government used to do good things, um, they had been given a federal grant
Oh,
The
okay.
memory center to create a cohort of people eligible for drug trials. Rather than waiting until you had a drug company say, we want the trial. So I was part of this group that went through all the advanced testing, including the PET scan with contrast,
Got it.
to
Because you were part of the
determine.
cohort. Okay.
So then, and indeed, a trial came up here in the metro area that I met and was in that before they started
So they
treatment.
pre-screened you, so when the trial was ready, it was efficient. You right out the gate, you could take part. Very good. Very good.
But it got me the diagnosis.
Mm-hmm.
It was able to determine my exact status with this disease. Uh,
Which goes back to your earlier point, Sam, about knowledge is power. And even though you may think you don't want to be tested or know this or know that,
right.
this is an example of how it could matter. If you want to go the route of, clinical trials, not everybody does, but if you
Well,
do,
but it's not just clinical trials though, but how to be treated and
right.
knowing what and on the lookout for advancements. And we should spend a minute there. Fraud and um, weird treatments in this field are
Oh,
so prevalent.
lots of
There's
scams.
lots of scams,
Yeah.
and look, there'll be one I'll mention in a minute, but we have talked about what's the experience of getting a diagnosis. Um, it is as frustrating as being told I'm mildly cognitively impaired. We didn't know what that meant either.
Right.
uh, you know, the moment of getting a diagnosis of, I was with Susan when they were told it was breast cancer. It's more like when they said, uh, when the doctor found a lump post mastectomy. But this is, I don't know, it was so hard for the doctor. We were taken into his private office and we'd all, typically you go to the doctor, you go into the treatment room, you wait 20 minutes, they show up. But we showed up and it's follow me down to that. And we're walking, we don't know what's up, but we're walking past these treatment rooms,
Ah,
uh, you
into the
know,
inner sanctum.
into his private office.
Yeah.
And it's interesting. He's behind his desk. Clearly, he's reserved. He's different in his presentation. And he literally, we're at a new diagnosis. It appears we are at a new diagnosis, but he mumbled early stage Alzheimer's. We love our doctor right now. And we've been in other circumstances where he came into our office for just a regular meeting and said, I need a minute. Just left somebody and delivered bad news. It's hard to deliver bad news. But for us to, we didn't know that much about Alzheimer's. We knew it was terminal. We knew, Dr. Alzheimer's and, dementia. I hate that word, by the way.
I hate that word. I hate so many of the words in healthcare. Don't get me started. That's a whole nother conversation.
But there's just, everything stops for a
Yeah,
moment. In the play, I said the universe stops. We just, you absorb. It's as if, it's absorb it for a moment. And oddly, we don't, we know what it means. And we don't start grilling him or crying or anything. We just, it's like you're in a new state of existence now, your new phase of
that's right.
existence. And you absorb it over some time. Um, there is the experience of, the odd experience of write a play. Is that how you're going to deal with this thing? You're not going to go get your affairs in order um, and it was odd. We do exercise every day, so this was a day every morning since I get on the elliptical machine. Even now, this was quite a while ago, and I was heard an author being interviewed. I was unaware of the idea of accompanied suicide to Switzerland. And this author had written a book. I'm not going to give her name or the name of the book. People can go hunt it if they want to. And she talked about the book she had written was about how hard it was for her and her husband who had been diagnosed with early stage Alzheimer's, my diagnosis.
Okay.
And they did go to Switzerland, and he did drink that cup of poison and commit suicide. And she in the interview were bemoaning, how come you can't do that here in the United States?
Was
And
she also diagnosed, or it was only her spouse?
it was just her spouse.
Okay.
And there was, I say nanoseconds, but it made me say, I wonder, is that something I should do? It was that reaction that made me angry, that I would think of doing that. And that's what sort of put me on a fuck this disease. I'm
Yeah.
not going there. I'm not going to be that. I'm not going to give up. Now,
Fascinating. Okay.
I there are distinct camps today. There is a growing movement
Oh,
still.
for sure.
You get diagnosed with that, don't kill yourself. It's not worth the journey. There was a well-known. It's funny. I laugh because I have all his contact in my phone. He was a consultant to Bill Clinton. I obviously had interacted with him. He had retired to Santa Fe, and there was this obituary one day, which he was quoted saying, "I didn't want to continue to be an undue burden to my family," and he went to Switzerland. He had Alzheimer's and drank that cup of poison. And we have so much back to what I said. I believe we have so much to give, and everybody's different, and we can talk about solo aging, which is harder when you're alone.
It's so
But
hard. Yeah. As
but
someone who, yeah, is doing
yeah,
it.
but now that but you had, Brian had you, I have Susan, and there is a
It's a
gift.
very different experience. Even when I earlier this year was in the emergency room with this terrible sciatica in just unbearable pain. And I stay away from doctors myself, but this was like nothing. Anyway, the point is I was alone when it happened, and I was in agony, and I was scared, and I couldn't even get to the phone. And it's a very different experience than just screaming for someone in the next room to come help you when you're alone. And
It's
then, of course, I had my kids, and I got better and all of that. But I started thinking, you know, I am alone now. So it's a different experience when you look longer term. It's a very
well.
different.
I will also say you've gone through the experience of being the care. I call them love partner of someone with a cognitive disorder, neurocognitive disorder.
Yes,
And Susan is mine, and of course, and then I was Susan's hers, where she was in her
sure. When she was so sick.
but
Yeah.
she was always Susan.
Yeah.
And she could express her will, and she could boss us around as needed, and we could help. It wasn't easy. Look, I held out the metal semi-circular metal pan and held it to her. She had to throw up. I slept in the hospital room. She was always Susan.
Yeah.
And caring for somebody who changes so much, I think the care partner role in this disease is magnitude of orders different and harder than anything I've ever seen.
I
And
won't disagree.
I don't, it's like I want to say all glory. I don't. There's no glory to it. I think we need to pay huge attention to that part of it for
Well, I
respiratory.
appreciate you raising that issue because I think it's starting to get some of the attention. I think people are starting to recognize just the toll it takes in every way. But it also raises a mirror to, well, what happens now if it happens to me? Because, I don't have a care partner.
Well,
And
and something, Susan was always Susan, the person I married, the person I loved. I may one day become a different Sam and no longer that person. And yes, we've been together, and it's complicated, but there are people who I'm
I get it.
I appreciate the change, and I don't want to minimize that happens. We were in a room, a couple of years ago, where in the back room during a funeral of somebody we knew, and he had dementia, and I overheard the wife said he wanted to live so much he was scooting out of the apartment on his bottom to go outside. I'm so glad he's dead. But that was just the pain of the process. And I think it's a huge issue, and nobody wants to feel that
Do
way,
you
right?
feel yourself as yourself changing or not as much? You think about it intellectually, or do you actually feel
I'm
like
aware.
you're different?
Oh, I'm changing. There's no, so one person with dementia, one person with dementia,
Exactly. That's my point. Yeah.
and our experience, it's in the play, but we've talked about it. Um, I can get really frustrated, and it can
Hmm.
manifest that way. People don't necessarily see it. Susan does, and one time I just blew up. Not at her, I just went, but I hit her.
You
My
what?
hand hit her. My hand hit her when I did that.
Oh my gosh. Okay. I missed that part. Okay.
She was uncomfortable expressing to me that she's afraid I might hurt her. Instead, she insisted we talk to a social worker. We did it over Zoom. She couldn't turn to me and say to me anytime alone or with that person. She had to look at the social worker. So, I mean, it's profound because I would never, never, ever want to hurt Susan. So that in part took us to more thinking about how do we do these next phases? Where, and you know, we are now at the point where going to move into senior living.
Hmm.
Um, Lots of choices. I thought, there's a Sunrise senior, not senior living, but memory and assisted living.
Yeah, yeah.
It's walking distance from us. Maybe she could stay here, and if I moved there, she could go visit. Most of it was assuming we couldn't be in the same place. So there's a new place nearby. We're getting ready to move there, and it's a new building, and they have a floor for assisted, and they have a floor for memory. And they say that assuming I'm not dangerous or too sick, we can move into the room in memory together.
Hmm.
We were thinking about again having this whole house is we need to
You're in a
downsize.
big house now. Yeah.
Yeah. But maybe we move into an apartment near a senior living or memory. She could still walk to it. We didn't imagine we could be that close together. So that's what our vision is. Be another year before we get there, but yeah. And then you can have a whole other show on the emotional journey of downsizing.
Oh God, yeah. Been there.
Yeah,
It's an interesting process, downsizing. Very
yeah.
interesting process.
Somebody told me, he said, we've done it. It's an emotional journey.
Sure it is.
And
You find handwritten things I found from my dad, who I love,
yeah,
and are you supposed to keep it? Of course I have to keep it. But making those decisions it brings you all the way back. It's
yeah. What about all these degrees I got on my wall? What about and look, my work with Nader was part
I
of the
remember your wall. Oh yeah, I remember
well,
that.
but beyond that, my early days, 70 was the very start of the consumer movement in this country.
Yeah.
Um, Real quick, you have heard, people will have heard that the Corporation for Public Broadcasting just was defunded. The Corporation for Public Broadcasting was created because an organization is, in part, an organization in New York headed by Thomas Hoving, who was head of the New York Museum of Art, organized an advocacy group called the National Citizens Committee for Broadcasting.
National Citizens, what now?
Committee for Broadcasting.
Ah,
Walter Cronkite was on it. Every major
network.
network was on it, and other museum heads were on it, and they succeeded. So who was the last executive director of the National Citizens Committee for Broadcasting?
Yours truly.
Because that was the group that had moved down to Washington, that had been working on sort of the general broadcasting advocacy. Newton Minow was an FCC chairman and
Uh-huh.
a vast wasteland of broadcasting. And this group was working on it. It was failing. I was a GS-15 at the Federal Trade Commission, making $80,000 a year at the time. We just bought a new home in McLean, had 2 kids. Ralph Nader calls me up and says, if you'll come over and take over the NCCB, we'll pay you $20,000 a year. It has $10,000 in the bank. And Sam said yes. Oh, anyway, um, so, so I don't know. That's sort of how I got into it. I'm um, the advocacy piece of it.
So with the play, so you were sparked into doing this play. You had heard about this woman whose husband decided to go to Switzerland because he didn't want to be on the journey. He wanted to end his life that way. You took a different path and you realized that you had a lot to contribute. And even if you're changing as a person, there's still value, there's still a lot left to live and give and share. And I don't want to put words in your mouth, but this is what I was hearing you say.
Yeah, and I end the play, and I still believe that, and I don't know this to be true, but it might be true. So the two things. This is one. There may be, is in my passing, one little tiny thing that will help bring a cure sooner. Maybe just a nanosecond sooner, but I have that gift. So going through it, a natural end in full medical involvement, there may be. And even though we don't know that, I'm willing to give that. I'm willing to offer that to
Humanity.
humanity, to the world. Then there's the other side of that. I can't imagine the impact on Susan of sitting in that room, her next to me as I drink a cup of poison. And again, it's a line in the play.
It's
Wouldn't
such
it
a
be
deeply
great?
personal, just, and as you say, everyone's dementia. You've seen one person with dementia, you've seen one. So, the range of experience is so
But would the
vast.
pain in that be even greater than if I hit her? I don't know. I don't. Anyway,
Yeah, yeah. And, you know, but as you perform Dementia Man, and I will say to everybody listening, we will have links for how you can view the show, get tickets for upcoming shows, get in touch with Sam if people are interested in speaking with you or
bring it to
having
your
you.
communities.
What's
Bring it
that?
to your community.
Yes,
Bring it to your
absolutely.
community.
And on that note, I do want to take a minute to do a shout out. To Rebecca Wellner in New York, who I interviewed a few months ago back in September, and it's on the Health Dame website. She is a young person in, early on, um, and one of the things that's really important to me at Health Dame, as I shared with you, Sam, is the intergenerational connection that people make in terms of their advocacy and their work that they're doing in healthcare. And Rebecca is this incredible dementia um, advocate is probably the right word. And she's starting up a nonprofit, a dementia cafe called A Sweeter Course. And I will also share links to that. And I know when I told her you and I were speaking today, she got so excited and was like, Sam Simon, oh my gosh, Dementia Man. And it's so great to be able to connect you guys. And I hope people will look at the interview I did with Rebecca because she's taken her love of baking and all things that are sweet and delicious and merging them with dementias of all kinds, and it not only mild, but all the way. And it's an opportunity for people in the community to learn more about meeting people with cognitive issues all along the different spectrums. There are many, dementias whether we like the word or not. There isn't only Alzheimer's, as we know. And, she's creating a place where people with dementia can continue to work and continue to contribute, to offer, your shows, your experience, and share with audiences, which is where, again, the arts come in to understand what it's like for you, for Susan, for your kids, and what you hope people will get out of your play. Like, what is the one thing or one or two things you hope people who come and see Dementia Man leave? What is something you hope after the experience they can take away with them?
You can live a meaningful life with this diagnosis.
Oh, that's fabulous.
You
I
can
love
live
that.
a meaningful life with this diagnosis. And it's hard stop. And that is,
And I would echo that because Brian lived a meaningful life till he took his last breath. And he still lives a meaningful life through the work that we do to keep him with us every day, every minute of every day. So it doesn't even stop then. And how can it? And I think it's just, did anything surprise you, in doing Dementia Man, or you kind of expected how it would roll out? Was there anything shocking that came of it, or not really? Since it's not your
all
first rodeo.
no, it all surprises me. I
Okay.
will tell you the one thing that I mean, there are many things I didn't expect, but this happened early on. And it's funny, it's not as often right now, but in most of the first, dozen or two shows, one of the first people would walk up to me afterwards and say, "Thank you so much. My husband, my uncle, my dad, my grandfather died. I always wondered what might be going on in his head."
Mm,
I think I understand it a little bit better. Now, I always say, look, I have no idea, but I'm glad it was meaningful for you. Because I don't know what goes on in anybody else's head. I can only
sure.
tell my story. But they took it and said, oh, so maybe that's why they were doing that. Maybe it made them feel better about the experience that can be fairly negative. And look, there's no question, like I said, I people can feel mean or bad because I go with my hand like that because I don't intentionally, but I get
It's
angry
frustrating.
at
Yeah.
myself,
Yeah.
and it can feel projected. It can feel Susan does, gets asked, and she has a group of other partners of people with dementia that she meets with once a month. So that gives her time off. We're looking at adult daycare possibilities before we move into the apartment, when that may be necessary. And then when we move into this senior living, there'll be ways that maybe I can be, give her time off from whatever I'm going to become. And we don't know that either.
No, there's no way to know. It's different all the time. It's always
And
a
you're
bit of a
frozen.
mystery, that's for sure. So before I let you go,
Oh dear.
Sam, I always end every conversation asking people I speak with what their favorite song is, because as you know, music and the brain, music was something Brian absolutely loved. So I have a Health Dame Spotify playlist. And if you don't have an answer now, you can always email me. But if you have a
Well, I have
favorite,
the answer.
okay, what is your song? I have my pen.
Unchained Melody.
Oh, that's a beauty. Okay.
Unchained Melody. Uh,
Oh my
it,
God. Is
it
there a
was
story behind that you want to share, or it's private?
sure, sure. Ghost, the movie Ghost.
Oh, with the pottery. Yeah.
And the love story there. And I was obsessed with that movie, literally. I mean, I watched dozens and dozens of
Oh
times.
my God, I never knew that.
And
That's
the music of it, and of course it was interesting. He was dying in that, or had in fact died. But I am there's poetry. I've also been writing poetry. Um, there's poetry on my website, but it prompted me to write poetry because the belief, the love, the love inside of you. So the last scene of that movie, he says to her, the ghost, as it's going back to wherever we go, the love inside of you, you take it with you.
Oh.
And I believe that.
What a great way to end a conversation. That's so true. Oh my God. Well, thank you, Sam. It was great to spend some time with you this morning, and I really appreciate everything you're doing with Dementia Man and your openness. And that's something I talked a lot with Brian about early on was how do we share this experience? Because if we're going to break through the stigma and get people to ask for help and talk about it, we have to be open about it and share the good, the bad, and the ugly, because we're not the only ones going through this. And it's the
Yeah.
only way we can try to make things better is, when you go to a doctor's office, you're in there for what, a few minutes, an hour at the most, but the rest of the time, the medical profession doesn't see what it's like to then go home and live your life. And you have to be able to somehow capture all of these learnings. And
I'm going to throw one quick thing at you that maybe you can edit and put it
yeah,
somewhere
yeah.
eventually. And that is when Susan, even in the early 2000s, was going through breast cancer, there were already breast navigators.
Uh-huh.
And then in 2024, Medicare said, we will pay for breast navigators. Now, I've just learned, first of all, we need cognitive navigators. I don't think anybody should be allowed to practice the neurology of cognitive disorders without a social working or social support somebody in that office. So
That's a great idea.
when we had to walk out from
Yep.
it's Alzheimer's, we walked home. We as good as a Snoop doctor was, we were awash. Now I there is news. I just discovered there is a trial called GUIDE, GUIDE,
Yep.
that I guess Medicare is putting out there for the same kind of cognitive support,
Yep.
cognitive navigation. And it's an 8-year trial, but you have to get it through your provider. I've Googled the metro area, Washington area, and there's nobody, uh,
I'll
no
look into it
provider.
too, Sam, because I think there might be. Yeah, let
I
me
would
see.
hope that one of the providers, is part of that system. And interestingly, through Susan's healthcare, we got a call one day that the healthcare system said that they had got a referral to come visit me at our
Oh,
home, but it's not. It's a medical. It's a home visit practice, different from my. It's not the navigator, not somebody specialized in
it's
cognition
something else.
and work and these diseases and knowing this disease and who can help and that sort of thing. And they don't have, they can give you referrals and the like, but the guide program, I'm hoping will be very good and it's covered by insurance. So,
Yeah, a
um,
lot of the advocacy groups are very high on it, so it holds a lot of promise. They've got a lot of input in how they put it together, so time will tell, but it's a good step in the right direction, I think.
okay, you're gonna have to break this into two
I
to in a
think
series.
so. I think so. All right, my friend. Well, you take
All
care.
right, thank you.
Give my
You
best to
too.
Susan, and we'll get all the links up on the site, including your Washington Post recent story where they interviewed you on Dementia Man. We'll get all of that so people can follow up, and I'll let Rebecca Wellner know, and we'll get you guys
Please do.
connected because I think that would be amazing. So I will be in touch, and you'll hear from me soon. Thank you again, Sam. You take care. Bye now.